So there are, as I described, new technologies to be able to sequence about 2% of all of our genetic information, which at this point we think houses about 85% of mutations. That was the exome that I had referred to. At this point, in terms of the actual cost to generate those data, it's on the order of $800 to $1,000 per person in a scientific research laboratory to be able to do that. And so these are still not trivial experiments to do from a cost point of view, but certainly much less expensive than they used to be even 2, 3, 4 years ago. There are other groups that try, in fact, not just doing the 2% of the exome, but in fact doing all 3 billion base pairs. The entire genome is what we call it, all of the genetic information. That's certainly a little bit more expensive. These days is on the order of about $3,000 to be able to generate all of those data, so still not inexpensive, but affordable when you think of the investment for individuals with rare diseases to understand this, something that can be affordable either for research groups or research communities to do this, or I'll even be provocative and even say for families that want to pursue this on a clinical basis. So let me say that one of the things that I have found to be very exciting, and we've worked very hard at doing, is to move this very quickly from something that was only a research tool that is now something that's accessible to patients for clinical diagnosis as well as clinical care. And I think this is a very important point that I want to make sure families understand, is that the technologies that I've been talking about are not just esoteric things that are done in ivory towers like Columbia University, but are actually things that they can go to their doctors about if they have a condition, a rare disorder that they may not have a definitive answer for yet about what's causing the problem, and whether it's running in families or for certain individuals, as I said, where it seems to be a significant problem for a child, even when there's been no family history. In both of those cases, a clinical exome sequencing may be able to help discern and identify if and what the underlying genetic cause is. There are many clinical laboratories that are now offering this service, and many of them actually are taking and accepting insurance to be able to do this. So again, we've worked very hard to be able to make this accessible to families so that they can feel empowered to be able to help understand their own family's condition even better. Once those answers come up about what's causing the condition, it certainly does not immediately provide a cure. There's certainly many steps beyond that that we have to do to understand treatment, but many times there can be immediate clinical implications for that information. For some families, it's simply answering the question of why, being able to, in an esoteric cosmic sense, be able to understand what caused their family's disorder. In some cases, it provides prognostic information, knowing now that this is a part of the puzzle, but what's the full spectrum of what they might expect and what that clinical course might be, as well as, importantly, things that they can watch for and be proactive and preemptive about. If there's something that might be coming down the road, to be able to screen for it and start treatment for it at an early stage while it may have a better outcome. In addition, for some families, especially those families that are relatively young and thinking about having other children, it may provide an answer to an important question of, will this happen again? An important corollary of what can I do to prevent it from happening again if they're concerned about that. And again, finding that there is a genetic basis for that can be very powerful to understand that either it might have something like a high chance of happening again, 25% for instance, with a way of being able to avoid it and have healthy children, as well as the other end of the spectrum where we find it's genetic but a de novo mutation, which is very, very unlikely to happen again and may be greatly relieving to those families to go on and extend their families to have other children. So it can provide a lot of immediate answers to questions that may have immediate impact.